Hello.
Hello, how are you? Happy New Year. Good afternoon, everybody. My name is Christina Ramos-Callan from Health Management Associates, a consulting firm that works with Sturdy Health on this RFP and the community health needs assessment that informed it. I'm joined by my colleague Madeline Shea, who is an expert on community health improvement projects, and we'll be talking about the proposal. We helped prepare the proposal and will be assisting Sturdy Health with moving through the proposal and implementation process of the community health improvement initiatives. So we're happy to have you all here to talk about the proposal today. I'm going to share my screen and we'll have some time at the end for questions. So jot your questions down so you don't forget them and we'll get started. So by now you should have seen this request for proposals for community health improvement initiatives, which was released earlier in the week. And today we're just going to go over the community health improvement initiatives, talk about the opportunity, talk about eligibility and some proposal elements. We'll talk through the technical proposal requirements, the timeline, and then we'll have a little bit of time for questions and just discuss some of the resources. We won't show the resources on screen. They're in the proposal itself, the RFP itself, but we'll just walk through what's in there. Sturdy has 2.6 million in community health improvement funding for these initiatives. The funds will be granted in early 2026, so by the end of this quarter. They can be used over the next 3 years, and they're meant to focus on projects that are in Sturdy's service area, prioritizing the populations in the service area that are most in need. Everything will be reviewed through a lens of equity of access to care so that we can make sure that when things to improve the community come along, they help everyone, and they especially help those who need that help most. For eligibility, we are looking at not-for-profit organizations that are tax-exempt 501c3. We are looking specifically in this defined service area. We know that there are primary and secondary service areas that Sturdy serves. This is the defined service area for this RFP: Attleboro, North Attleboro, Plainville, Foxborough, Norton, Rehoboth, Raynham, Mansfield, and Seekonk. And the priority populations that we're looking at are those who experience barriers to accessing primary care services, people with unmet mental health and substance use disorder needs, people who are financially insecure, older adults, and people who are housing insecure. And I want to turn it over to Maddie to talk about the technical proposal requirements.
So all of the proposals should have a problem statement. So in your proposal, you would describe the needs that you'd be addressing in this problem statement, how you identified those needs, and provide supporting data. You will tell us about how your initiative will address the important problem that you want to, that you've identified, and how that relates to the stated Sturdy Health priorities, which, are well laid out in the RFP. You will tell us what the impact of the project will be on the health of the target population. So, for example, you'd reach so many people and stratified by age or disability, gender, race, ethnicity, and how not just your reach touching people, but how those people will be better off. Next slide. So you will have a program description, so how you developed your initiative, and why we think it will work. What's the evidence basis, or what promising practices or programs are you thinking about when you propose this? What do you need to say what the demographic and geographic reach would be, like who will benefit? So by demographic, we mean the people. What are their demographic characteristics, age, race, ethnicity, gender, and geographic would be the place where you'd be reaching them. You will describe who will benefit, from the project and how they will benefit, and what activities are in place to maximize opportunities to make an impact. So for example, if you're building on something, those would be activities you have in place that you would be building on to further the benefits of what you do now. If you have any program restrictions, you must state those. If there's certain people who would not be eligible for your services, you do need to identify them in your proposal. You should provide a description of any partnerships, and we are very much looking forward to seeing proposed partnerships. So a list of potential partners, their roles, their infrastructure, if you have an ongoing relationship with them, what that looks like, and an outline of how you will work together to complete the project, including, how you would build on that. Is this a one-off? You would describe the anticipated impact of the project on the health of the community members targeted. You're hearing that over and over. We want to hear that you're going to have, what we are looking for, proposals that are going to actually have proven outcomes in the community. You'll provide details on the anticipated reach using the number or percentage of the population affected. Next slide. You'll need to list your goals. So specific goals and objectives related to the problem, using, SMART goal approach: specific, measurable, appropriate, realistic, and time-bound. You'll also include how you will evaluate your work. So identify the performance measures and processes for tracking and evaluating outputs and outcomes. You'll specify tools that you will use to measure progress and outcomes, indicate how data will be tracked and reported to Sturdy Health, and how data will be used for continuous quality improvement. So to evaluate how you're doing and how you will adjust if you're not seeing the results you were looking for. Next slide. We have forms in the RFP to just help you lay things out in a way that be really clear for the objective reviewers, so that this is to help you put your best foot forward. So you would lay out your objectives, key action steps, like how you're going to achieve that objective, expected outcomes, and timeline for each goal. Next slide. We are one of the ways that proposals will be evaluated is looking at the organizational capacity and experience of the proposers, the organizations leading the proposal. How you will do that is by providing an organizational chart, your track record of providing services like this, evidence of your ability to identify and address barriers experienced by the priority population. So you're not new to this. Describing how you engage the community in planning, oversight, and evaluation. Describing how you ensure that staff have the training that they need to implement culturally and linguistically responsive and trauma-informed programs. You will describe the relevant credentials and experience of program leaders, and you'll attach letters of support from any partner organizations that you proposed. Next slide. So we want to also hear about your thoughts for sustainability, because one-offs we're really looking for proposals that could be sustained beyond this initiative period. So you will speak to that in your proposals. You will also need to include a budget, and there are budget forms provided. Next slide. And here's the scoring rubric. So there will be an objective review of the proposals, and total points for, winning proposals. You're going for 100 points, would be 100 points. And the problem statement and needs statement and justification is 20 points. The program description, goals, and evaluation plan is 25. The work plan, so the specificity of what you will do, is 10. Organizational capacity, 15. Sustainability, 10. Just so you know how to gauge in your writing, making sure that you're getting your points across in each of these scored sections. Next slide. We are right now at January 9th at this virtual information session. I was going to pass it to you here, wasn't I, Christina? You're on mute.
Thanks, Maddie. Sorry about that little confusion. And I realized that when I was doing the intro, I think I hit the arrow key a little too hard. So I'm going to just jump back a second before we get to this timeline. I want us to just walk through very quickly. Let's see if I can do it from here. Pardon me for the clicking. Okay, so let's start from here, right? There's $2.6 million available. We talked about this. They'll be reviewed through an lens of equity. We want to just briefly just talk about what these funding priorities are and how they were established. There was a community health needs assessment that we discussed, that we mentioned before. There's a link to it in the RFP. If you access the RFP online, you can also go through the Sturdy's website and see the publicly reported community needs assessments over the years. In those assessments, for this process, this is part of a determination of need process that Sturdy is going through because they have some expansion projects that they're doing for the emergency department or the emergency room. A requirement from Massachusetts Department of Health and from Department of Public Health and the executive office, when you do a determination of need project, which is required for large construction projects and projects that are generally helping to improve services in a community, part of the requirement for that is to make significant investment in community health initiatives and community health improvement. So that's the origin of the funding, and that's all explained on the website as well. In addition to as a result, in addition to the community health needs assessment, other things and areas of focus that informed these priorities include specific Department of Public Health determination of need priorities, as well as Department of Health and Executive Office of Health and Human Services focus issues that are global to all of the Commonwealth of Massachusetts. We also got significant input from community leaders and stakeholders to walk through the relationship between the community health needs assessment findings, the state and Commonwealth health priorities and whatnot, to make sure that we had a set of focus areas that were meaningful and relevant to the community. And those include increasing health and social care access, increasing the prevention and management of chronic conditions, expanding affordable, stable, safe, and accessible housing, and reducing social isolation among older adults, youth, and people with disabilities. And complete descriptions of these are included in the RFP and in the community health needs assessment. Now we'll go back to the timeline. Again, sorry for scrolling. Okay, so today is January 9th. We're having this information session. Please compose questions. I'm sure you have some questions that you may have started going through as you've been reading them since you received the RFP notification. The last date to submit questions about the RFP for clarification is January 12th. So send your questions in by Monday. And then we'll go through all of the questions with Mel and the team at Sturdy and issue clarifying statements about any questions that need to be addressed. And those will be posted with an addendum to the RFP on January 20th. At that point, you'll have the remainder of the time period until January 30th to complete your proposal and submit. Right? We always recommend, as RFP responders and grant writers ourselves, we always recommend that you plan to have your RFP done by at least the day before, so that when you're ready to submit, you can troubleshoot any problems, Wi-Fi going out, printers, if you want to review things, what have you, computers crashing. We don't want anyone to have any technical snafu impede their ability to apply. But the deadline is 3 p.m. on January 30th to get that email in to Mel Reichel. The notice of awards will be issued by February 16th, and then we expect the initiative to launch on or around March 2nd. At this point, we have time to talk about your questions and answer them. So I'll take the slide down so that we can have a discussion, but just make a note of the email address for sending your formal questions by January 12th before I do that.
And Christina, I can start with the questions in the chat.
Great.
So I'm seeing there is some confusion about the period for the work. It is 24 months. So for 2028, it would just be the first 3 months of that year. It's not a 3-year award. As stated in the RFP, we'd be looking at 2 years of funding in your proposals and in your budgets. So the start date we're estimating would be March 2nd, as Christina just said, 2026. And the end periods then would be March 1st, 2028. Hopefully that clarifies the questions I'm seeing in the Q&A here.
Yeah.
Can
you address the project timeline question?
So I think,
like, is there a required start date?
yes. So just as I just stated, we would expect projects to start March 2nd and end March 1st, 2 years later. The budget range is stated in the RFP. So I need to pull that up. Sorry about that. But it's definitely as specified in the RFP. Christina, do you have that pulled up?
Sorry about that. Yeah, so I'm sorry. Sometimes when you're looking for something, it's the last thing that you can't see. Awards, where are the awards? Where are the awards? I'm sorry, I'm having a hard time finding it on the document, but it should be in.
We will restate the period in the response to the questions that are due on Monday. But I can tell you it is stated in the RFP, which neither one of us have in front of us right at this moment. I'm sorry. The cap on administrative costs is also stated in the RFP. And again, we will restate that in our response to questions. You're welcome, Mim.
Right. The total funding pool, and here's why I didn't find it, because I lost track of this thought. We didn't state a specific funding range, but we are limiting it to 8 projects. So up to 8 projects can be awarded. So this could be a handful of medium-sized projects and then a couple of large projects. It depends on what the proposals look like when they come in. It's discretionary to, if there's a large project that has a lot of opportunity and several smaller projects, Sturdy may decide which ones they're going to fund, and they may decide to fund fewer than 8, but they will fund a maximum of 8 projects with the total pool. So with that said, you should be looking at things that are sufficiently planned and have sufficient evaluation and work plan worked into them to make a proposed significant difference in community health.
I can handle some other questions. Catherine asked, yes, this Sturdy Health will not be funding medical treatment covered by Mass Health. That's prohibited, incidentally, by the state. The purpose of this funding is to complement medical treatment services that are already available. It can increase access. In fact, there's a priority around increasing access to medical treatment, but not providing medical treatment specifically. So that is not what Sturdy is looking for here.
And I'll address, you want to address the question on contractors and lead. I'll reframe the question. It's a question from a person who is not themselves a 501c3, but it sounds like they work with 501c3s as a subcontractor or in some consulting capacity and want to know what the appropriate pathway is to engage in the funding opportunity.
As stated in the RFP, this funding is restricted to nonprofits.
Nonprofits and governmental agencies to a
Yes.
certain limitation. Yes, correct.
Right.
Yeah.
So I would say, as someone who frequently works with not-for-profit organizations in operating capacity and administrative side, I would look at the administrative requirements and strictures of the budget, and then I would think through if my lead entity on the application is a not-for-profit organization and they need to employ or subcontract some portion of their program out to an individual to assist, that needs to be clearly defined. The lead applicant needs to be the 501c3, not-for-profit or governmental organization within limitations. And then the means by which they intend to utilize capacity, subcontractors, whatnot, needs to be clearly defined in the budget, because there are certain things that are clear program expenses, and then there are things that are overhead and other costs, and there are strict limitations on what's included in that pool, as in the RFP. And if you have something more specific than that you'd like to ask, I would suggest that you submit an email to Mel about it. Thank you for the question. It was a good one.
Karen asked if an organization can submit more than one proposal. We did not answer that. We will put this in the, but we would not recommend that you do that. I think that could water down both. If you want to be in more than one area or have different components, a winning proposal would likely integrate those ideas as opposed to having 2 separate proposals.
My general recommendation is, if you have 2 really good ideas, do a bit of a prioritization exercise to figure out which ones are most achievable, most feasible in the timeline that you have with the available budget and capacity of your organization, and then use that to guide your decision on what to submit.
And Catherine, it is specified in the RFP. Community health worker services are a priority. They're very much of interest. Social worker, nurse services that are not eligible for reimbursement could definitely be part of the outreach health education component of, you know, either the chronic disease priority or the healthcare access priority. In fact, those would probably be very much of interest. Capital
There's a question-
investments,
Capital
no.
funding.
Yeah, no, we are not looking for a sturdy, and that is specified in the RFP.
Right,
We
and,
will
and,
provide.
yeah, capital investment, the issue being that most projects with capital investment have a long lead up time. And it's typically, you're just not able to get to that point where you are demonstrating outcomes and clear improvement in the community health initiative and in the community health improvement plan, which is the purpose of the funding, by the end of the funding period.
And
Yes,
Ellen,
the initiative launch date includes the initial planning.
yes. And it is a priority population are persons with disabilities too. So perfectly acceptable to have a focus on adults with disabilities, particularly
Yes.
around social isolation or housing, actually all of the priorities.
Yeah, thank you for the question. Read through I would suggest you read through the specific focus area explanations that are in the RFP, but really go ahead and take a good long look at the community health needs assessment, which will give you framing and context for those priority issues.
And typically philanthropy is not a good sustainability strategy in terms of seeing sustainability. So we'll be looking for creative ideas of how to sustain services. It would depend on what the service was, whether it would be picked up by a payer, or, you know, mixed method with fees. But yeah, philanthropic spending is not typically what we would look for sustainability.
Parameters around staffing, current versus new.
Salaries. Yeah, I think no, but you know, budget is an element of the objective review. And if salaries are not according to, you know, the norms in the marketplace, that's probably going to make you, you know, that might lead to not scoring well in the budget.
Oh, people saying people can't see the question. So we'll do our best to kind of reframe the question so that it's applicable across the general audience. Right. And, you know, when you're designing these programs and budgeting them out, remember that depending on how your organization is configured and the services that you offer, you know, you may elect to, it's not uncommon for organizations to dedicate a portion of a salary or a portion of a staff member to a project. So think through your ability to steward your resources in such a way that you can clearly connect the budget that you're submitting for this project to a sustainability plan.
And whether funds can cover an existing salary, absolutely. You know, I think budgets will, you know, if someone's role is expanded, and now, you know, 4 hours a week are spent on expanding services, then you would expect 4 hours a week of that salary, which would be a 0.1 FTE, full-time equivalent, would be in the budget, and you would justify that.
Right.
So
Right. Or if you need to juggle salaries or juggle roles between individuals, then you would do that. I've seen plenty of proposals in my lifetime where someone has a role that does one thing and they are especially attuned to this new program, so they get reassigned. And now suddenly 0.4 FTE is for this other thing that they're doing, right? So you can talk about that and explain that in your forms. And I should also note that when we included the forms in the RFP, those aren't fillable forms that you type into. They're meant to be templates. You can go ahead and use Excel or a Word table. Then those were just to give you guidelines of what the headers of each column need to be. Right. I think we've answered all of the questions. I saw one, I think you answered the one about medical services not being permitted. And that would include, there's a question, there was a question about, can a for-profit company that uses in-house occupational therapy be to assess need be eligible, or if they're a contractor for safety and aging in place. So again, eligibility is limited to not-for-profit organizations and medical things that are medical expenses that would otherwise be reimbursable or eligible for insurance and whatnot. Those are prohibited by state funding rules. So I would look through the RFP for those eligibility requirements and those exclusions. There's a section on exclusions that gets into this.
But in terms of home safety, we know that occupational therapists are often part of an evidence-based intervention. So paying a contractor who's an occupational therapist as to deliver the program would be perfectly acceptable. It's just that they couldn't be the lead. They would be a contractor.
And so one other thing is to, not that there's a question about it, but just to clarify, the applicant organization should be located in or actively providing services in the service area. So you might be located in, but not necessarily delivering services in the service area yet. But if you can demonstrate your capacity and experience to do so and have a strong proposal for how you would deliver the service, how it would impact the community, and what the viable sustainability plan would be, then that not-for-profit organization would be eligible.
And partnering is a way to have a stronger approach there. And Catherine asked another question about planning to fund several projects in each priority area. Sturdy Health will have an objective review process, and the best proposals will be funded. So if they all end up in one, that's how the chips will fall. So there isn't really an intent to distribute the funds across the priority. I mean, I think there's the hope that there will be great proposals in all of those. And one proposal can address several of those priority areas. We can think of many evidence-based practices that would do that. So I hope that answers your question, Catherine.
Not seeing any other questions in the Q&A queue or in the chat. Just want to put out a last call for questions from folks. And just remind everyone that if you have additional questions, you should send them via email to Mel, and they'll be addressed in a formal response to Q&A. Q&A responses that are published in the Q&A, apart from a couple of clarifications that are very clear from today's discussion. We're not going to repost all of the responses to the questions that we answered today. There might be one or two small things that we'll correct. But other than that, the Q&A responses you see on the 20th really will be limited to those questions that are submitted in writing. So please submit your questions in writing if you would like them documented there.
Okay, Mel, I think
a full list of city and towns in the service area is in the RFP, but let me see if I can go back
of the
and just share that
priority
slide one more time.
the RFP lists the prioritized cities and towns. It's not a complete list of cities and towns.
Yeah. So you should see a eligibility slide with priority locations on here. But again, I encourage you to really take a good look at the findings of the community health needs assessment and how it describes the current status and needs of the communities in the service area as you are informing your project plan.
And the timeline slide, Melissa, is in the RFP.
Yeah, it's on the front page of the RFP.
I'm going to hand it to Mel. I think we want to thank you all for your participation today. And Mel can close us out.
Thank you so much. Yeah, perfect. Christina, I was just about to do the exact same thing. And to their point, a lot of the information is in our community health and needs assessment. It actually does very clearly list out those service areas. Just because I do have it in front of me, I'll show it off for a quick second to say this is actually all of the service areas for primary, of sturdy, and our secondary. So this is in that document that we've been referring to, our large, lengthy community health needs assessment. If you are on the internet, you're looking to go look through things, you can type in sturdyhealth.org, CHNA. It will bring you to community health needs assessment, and you will have this main form where you can download the needs assessment here, or you can learn more about the RFP exactly like we talked about, and this is the remainder of the information. So perfect.
Yep. When you click on the link for the needs assessment, it will open a PDF. Unless you're on a Mac. If you're on a Mac, it'll open or an Apple computer, it'll probably open a new browser. But on a PC, it'll open a PDF, and that PDF will generally look like this. And it has it's 56 awesome pages of information about priority health issues, needs, and the service areas.
Thank you.
So we invite you to look at that to help inform your planning.
Perfect.
And then at the end of the RFP, there are just some additional resources on choosing evidence-based programs, on definitions for some of the terms that are used to describe the priority issues, as well as other planning tools that you might find beneficial. Please go ahead and take a look through those to see if they'll help you in crafting your proposal.
Right, and I know we are a bit early, so hopefully that's nice for people who are eating lunch at the same time, that you have 20 minutes to kind of actually digest the food now. We have recorded this. Once the recording is formalized, we will make it available along with materials, as mentioned, the formal question and answer of exactly what to expect. And please, please, please don't forget to email me if you have additional questions. My email is in our everyone chat. We should all be able to see it. And as Christina has called attention to, it's on the RFP directly if you have questions. We will go through the questions. We'll candidly be able to answer them in the best way. We'll work with this team to make sure that you all can apply the best way.
Right. And as people send questions, we'll acknowledge your question was received, but we'll answer it on the 20th when we answer all of the questions.
Yes. Thank you, Christina. Great call. All right, unless there's anything last minute from anyone else, I will wrap us up. Thank you. Stay up to date on the CHI information on the webpage. Look for our information, and everyone will be able to hear from us soon. And we look forward to reading some proposals.
Thank you.
Have a good weekend, folks.
Thank you, everyone. Goodbye.